Hi guys, you're all welcome to my life once again. Okay, so today I want us to discuss something very important. This issue, like, let me say, if I bring 100 persons here, 80 percentage of those persons have this thing, and most of them keep going back to the same issues because they have not known how to really take care of it. Okay, and that is stomach ulcer. Let's talk about stomach ulcer. You understand, what are people doing right? Like, what are they not doing right? Why is that this it keeps coming back as if are you the only person on this earth? You understand? So let's talk about stomach ulcer. Okay, don't mind the background noise. I'm in my house. I have to put this video up because it is affecting a lot of persons. So let's do a quick one about stomach ulcer, why it keeps coming back, okay, and the possible drug that you can use, like, and the ways you can follow so that it will go away. Okay, so let's talk about it. Before then, this is Pharmacist God's Gift. Okay, if this is your first time you're coming across my channel, I am Pharmacist God's Gift, and right here we talk on health matters and also drug information. So today I want to tell you about health matter, which is stomach ulcer or peptic ulcer as people used to call it. Okay, it affects a lot of persons. That is why I want us to talk about it live today, like live. You're gonna be hearing what is it. Okay, that is it. Then if you want me to make a full video for each for a full video on it, showing you the drugs and everything, then you can put it down in the comment section, then I'll make a video like that for you. But for since it's live and I'm in my house, I'm not with the drugs right now, so I can't be showing you this is it, this is it. Okay, so I'll just call the name for you. Okay, I mean there is a place that I can be putting the names of the drugs as I called. It would have been better, but I'm not seeing any of such. So, and this is my second time of coming live, so I've not still known how to use the buttons very well. But don't worry, don't worry, anyhow, they're still going to be good. Okay, and it is. So don't forget to like and subscribe. Okay, now let's begin. So I've been noticing this thing that people come to the clinic, the pharmacy, and most times they will say they have ulcer because they are not eating well. Okay, I always say ulcer is not about not eating well. That is not the cause of ulcer. Okay, the number one cause of ulcer is bacteria. Okay, bacteria. So you need to know this before you can say you want to take drugs. So when some persons give you antibiotics for ulcer, you will not say I'm not taking antibiotics, I don't have any infection or anything. No, it's bacteria that is the causative agent. Helicobacter pylori, that is the name of the bacteria that causes ulcer. So please, let's keep food as some aside, which I will tell you what food does, but not the major cause. Okay, then other causes of ulcer are smoking, people that smoke a lot, that drink excessive alcohol. Okay, they want to take alcohol to drunkenness. Those persons still have that too causes ulcer. And also people that take body pain relief, like we call them NSAIDs, but most persons know them as pain relief, but we call them non-steroidal anti-inflammatory drugs. Okay, but most persons know them as pain relief. Those persons have high chances of having ulcer. Okay, ulcer is wounds that are found in the lining of your stomach. They are wounds, they are just like there. So if you keep doing all this bad habit, it's like you're making the ulcer to come more and more and more. Okay, welcome City Rema, welcome. You look like a doll. Thank you. I'm not a doll, actually I'm a pharmacist. Okay, less than God's Gift, a female, like, I'm not sure you're a female, Sha, but I'm a female, not a doll. Okay. Thanks for the comments, good or bad, all of them wonderful. Let's continue. So welcome Anuraj, welcome. Today we are talking about ulcer. Okay, stomach ulcer, those persons that have not been getting it right. Okay, so that is it. So as I was saying now, the persons, there are some things that triggers, we call them triggers, they make this ulcer to come. Okay, don't mind the background noise, I'm in my house, so there's dogs barking, everything, as it's morning. So please don't mind the background, my boss. Let's continue. So if you are talking about now, the trigger is the food you eat, the hunger you keep yourself. Okay, so the food, this type of food that you are eating, that you're not eating well, those things too can cause ulcer. Some persons like proteinous food because they contain ammonia. causes ulcer or make their ulcer, triggers their ulcer. Okay, we call them the triggers. Okay, not the particular thing that causes ulcer. So I'm telling you what food does now. Food is like a trigger, not the cause. You get? Okay, so now of spicy food, some proteinous food, and also fruits. Some fruits like oranges. You're taking oranges on an empty stomach. All those ones are trigger. Okay, that is why some persons also don't used to go away. Okay, open a little wider, boo. Okay, welcome the mighty. I don't get that. I don't get that. Okay. Yeah, pylori. We are talking about pylori. Welcome, Mr. Cylinder on the sec. You're welcome. And turn around so you can see how it looks from the back. The Lord is our strength. Let's don't get distracted, okay? So looking at it, we are talking about the ulcer. Why some persons ulcer don't used to go away. Yeah, they don't used to go away because they keep going back to the bad habit. Okay, if you go to the health provider, they've given you the drugs and you've taken the drugs. The thing that will make that ulcer never to come back, because I have ulcer. Okay, let's keep it. I have ulcer. So I know what I do to myself that it will never come back. Okay, there are some persons that if they even when they have the ulcer, to eat is a problem. They will stay hungry, like keep themselves hungry. Okay, so if you have ulcer, try as much as you can to eat. Okay, eat very well. Make sure that you don't keep yourself hungry. If it's 3 times, you can do at least 3 times. Okay, so that you won't have the wound, because ulcers, as I told you, is wound in your stomach. So if you're not doing anything to take care of that wound, there is more acid in your stomach trying to look for what to digest, and they're not seeing anything to digest. They will start digesting in your stomach, thereby making more, wounds or ulcers in the stomach. So try to eat very well. And if you have ulcer, then you're the type that don't like the spicy food, triggers your ulcer, like me. I can't eat pepper, spicy food. Indians, people will say spicy, spicy. You can't eat spicy food. Please just leave spicy food aside, because me, if I eat spicy food that day, I will not rest. The ulcer will be too much. So just leave spicy food around, okay? Then if you are going to the hospital, please, if you are following me, you can be taking note. Okay, eating healthy is not gaining more weight. Okay, eating healthy, as you say, if you eat junks, that is what gives you weight. Okay, there is what we call portion control. Yeah, portion control. You don't go junk up yourself with food because you want to fill your stomach. No, now it's portion control. You can eat a good portion, take your fruits, okay? Then you will know that it will take you till the afternoon period. You take a moderate portion, like that you won't even gain weight. Rather, you will feel okay. And if you're scared of gaining weight, please do exercise. Exercise in the morning, burn the fat, okay? Burn the previous fat for the day. Then you eat. So it's not like you're adding, you're burning, you're adding, you're burning, you're adding. So don't be scared of that, okay? So healthy food does not, give this thing. If you're eating junks, and you're bulking your food that you want your stomach to be full, it's not the health that you get in the food is not the amount of food you eat, the plenty how it your stomach wants to be full. As far as you're eating to your satisfaction, okay? Because in the long run, it's not consistency, it's costly as hell. Yeah, that is true, Sha. That is true. It's very, very expensive in this thing. But one thing I always advise, at least just do morning and evening, like anyhow you can, morning and evening. Okay, so the aim should be to set calorie aside. That is it. You can burn the calorie with little exercise now. Eat whatever shit that got control. Okay, whatever. To you, anyone that is good to you, you can just eat it. Yeah, but for me, I don't try spicy food because it's gonna disturb me, and sometimes proteinous food too is gonna give me all those bloating, so much gas in my stomach, okay, making me to go back to the ulcer drugs, and I don't like it, so I try to avoid it. These are what you will do that the ulcer will go for years before you now keep saying that I keep treating ulcer every year. it's because you are doing the wrong thing. Okay, then another one I want to say is, please don't take pain reliefs. If you have ulcer, if you're an ulcer patient, tell your health provider, we know how to give the pain relief. Okay, we don't just give the pain relief like this is the pain relief, take it. Okay, there are pain relief that are good for ulcer patients, and there are some that are not good. I think I've made a video like that. Okay, there are some that are not good. Okay, so we are going to selectively give you. So don't just hide yourself and say you don't want to hide yourself, and you don't want to tell your health brother if you have a ulcer or not. Please tell us so that we know the NSAIDs that we are going to give you. Pain relief. Okay, we call them NSAIDs, but they are mostly known as pain relief. Okay, those ones, the way they cause ulcer is just like when you take it, after taking it, it's like morning, evening, 2 times, you will start feeling the ulcer immediately. That is how bad that it is. And other one is, please stop smoking. If you're smoking, stop smoking. That one. Hey, ulcer will be your friend, best friend, if you keep smoking. And also, if you keep taking alcohol, ulcer will be your best friend. So, okay, what's that stick? What that sticky rice dish you guys eat a siesta? Are you talking to me or someone else? If you're talking about rice dish, we eat jollof rice, not sticky. It's jollof rice, sweet Nigerian jollof rice. Okay, let's continue. So that is it. Those are the natural way and the best way to treat ulcer. So after you finish you taking your ulcer medication for 2 weeks, please don't go back to this habit. These habits are very bad. Okay, and some persons are used to chew bubble gum, like you're hungry, you're still chewing bubble gum and you have ulcer. The stomach is expecting food, is expecting something to digest, but you are giving it false reaction. Okay, it's going to work on your body. Yes, the rice is jollof rice, Nigerian jollof rice, very sweet, and oh, you need to try it. But let's don't distract ourselves, but you need to try it. It's very nice. Okay, very, very wonderful. If you eat, you want to keep coming back. It's not that sticky. Jollof rice is not sticky. What about fufu? Okay, I know some audience will want to hear what I'm saying. We'll get back to that. Okay, I'll get back to that. So fufu, everything is nice. Fufu is carbohydrate food too, so it's nice. Okay, everything is nice. Then talking about where we are, so that we won't this thing. I was saying, which point okay. I was saying that you shouldn't take bubble gum on an empty stomach if you have ulcer. It's not good for you. Chewing gum, in Nigeria we call it chewing gum, but normal English is bubble gum. Please don't take it on an empty stomach. It's a no, no, no. And those persons that like fruits, a lot of fruits, please, there are some fruits that you cannot eat on empty stomach. If you have ulcer, you should eat very well before you take this fruit. Okay, like those citric fruits. Okay, the food that has acidic fruit, we call them citric fruit. Acidic, they have acid. Okay, and also it has to do with production of acid in your stomach. Okay, the stomach is pumping out acid. Their holes the stomach are pumping out acid into your stomach, so you don't need that. Okay, yeah, it contains base. No, it shouldn't what help though. Yeah, so please, those citric food are not good. They are not good. They contain high content of acid and vitamin C. Okay, vitamin C in this citric food are very, very high. Okay, so you don't need them, like your oranges, your lemon, your grapes, as I said, oranges, lemon, and tangerine. Okay, and a lot of them, even pineapple to contain some a form of this citric acid, like, yeah. So you should just avoid them. You can just do more of cucumbers, pawpaws, bananas. They are going to help suit, like banana. Yeah, banana helps to suit the stomach. Okay, it helps to suit the stomach pain and relieve pain. Yeah, that is a natural way. Vitamin C in bubble gum. Vitamin C should be in bubble gum. Yeah, that should be in bubble gum. Yeah, I think it should be, but I've not read the contents of bubble gum, so I don't know if there is vitamin C there or not. But it's just that vitamin C Okay, don't mind the backing of dogs and everything. Okay, just that vitamin C is not good. It's ascorbic acid. Ascorbic acid. Okay, so vitamin C contained in the fruits to contain this ascorbic acid. As I'm calling ascorbic acid, you should know that it contains acid, and the stomach in ulcer pathophysiology has to do with production of acid, so it does not mash at all. Okay, so please try to this thing. There, most of these fruits you shouldn't, yeah, you shouldn't take them on an empty stomach. That is what I'm trying to say. Now, if you want to take them, you eat first before you take them. Okay, so that is it. The backing of dog is much, but well, maybe someone is coming into the compound that they don't know. So let's continue. So that is it. Then some let's know all those ones now, so that your ulcer will go away, so that you will avoid. Okay, fufu is carbohydrate food. It's healthy. Okay, it's healthy is with a soup that contains enough vegetables, and all the full of proteins and this and that. Is very good. It's healthy. Okay, you can just do it moderate. Take more of the soup rather than the fufu. That is the language. Okay, so let's go down. Then let's go down. Okay, I wrote down some points though, but I've not even been looking at the points so far. Yeah, ulcer, if you don't treat it, is very bad. It's very bad. Okay, comply with your ulcer medications. Okay, and if you don't treat ulcer, it's very bad. It's going to give you more wound in your body. It seems like this is acid response. Okay, I don't get that very well, but that is it. So now let's go to drugs. That I want to tell you some drugs that you can use. Okay, I'm just going to tell you the major drug. As we started previously, I told you that ulcers are mostly caused. The cause is bacteria. Is not eating or not. Those ones are triggers, as I've said before. Is bacteria, Helicobacter pylori. Okay, so the best thing we should be doing, looking at, is if ulcers are caused by bacteria, then we should be thinking of killing the bacteria. Yeah, right. We should be thinking of killing the bacteria. So when you go to your health provider and they're giving you antibiotics, yeah, antibiotics to kill this bacteria, please don't be surprised. Okay, we do combination of antibiotics. Okay, I think that Helicobacter pylori is very stubborn. Yeah, for there to be combination of two different classes of antibiotics to kill it, it should be very difficult. Bacteria. So we normally combine two antibiotics to kill the ulcer. Okay, so we can do like the cephalosporins, or we can just say mostly we use the metronidazole, flagyl. Okay, flagyl, the amoxil. Yeah, mostly the amoxil. The hospital, they do that too. Flagyl and amoxicillin, but if we want to use our name, is metronidazole and amoxicillin, but if we want to know, use the common name, is flagyl and amoxil. Okay, those two are one combination of antibiotics, good combination of antibiotics that you can use. Then secondly, another combination of antibiotics you can use is even the claritomycin. Okay, the claritomycin, those are the macrolides, the claritomycin and this metronidazole, the flagyl. Okay, claritomycin and flagyl, or azithromycin and flagyl, or amoxil. Okay, so that's what is gonna be good. So I've told you two combination. Yeah, if you're having pain and this thing, you can just write down, so that if you don't want to go and disturb the pharmacy, you can just go and tell them that it should give you those drugs. But they are taking morning and evening, and you're going to be taking them for at least 1 week. At least 1 week. Okay, so don't go and do this, because there's what we call antibiotic resistance. So if helicobacteria resist that your drugs that you're starting to use, it's gonna be very bad. Okay, so please try to complete your antibiotics and finish the antibiotics. Okay, that is it. Then the second drug is the proton pump inhibitors. Okay, we call them the proton pump inhibitors. Let's forget about the big grammars. Let me just tell you how these drugs do. These drugs, they help to cover the holes, all the holes in your stomach. Okay, let me bring the language down. It helps to cover all the holes in your stomach that this helicobacteria is popping and bringing out acid. It helps to cover all those holes. Okay, so those are the ones that you hear, they will say they will call it lansoprazole, omeprazole, pantoprazole, osimoprazole. Okay, they are the prazoles. They end with prazole. So if you see a drug, any brand that they want to say prazoles, you should know that please, these are ulcer drugs. They are good for ulcer. So if you are taking combination of two antibiotics, you are going to be taking these proton pump inhibitors too. Okay, like that is like this. Look at my hand. You're going to be taking the proton inhibitors too. Okay, so you can take either omeprazole or lansoprazole or pantoprazole or cimetidine. Yeah, I know you've heard of cimetidine. Okay, those ones are antihistamines inhibitors. So cimetidine. So okay, you can get that to any of them. I don't mean to combine all of them. Any of these ones that I mentioned, you can get them. Okay, and you will use them for at least 2 weeks. At least 2 weeks. So don't go and take drugs for just 1 week and you're saying you want the ulcer to go. It's not miracle. The ulcer will go. It will go, like it will go fine. You are healing. It will go. But continue the healing process. Let the healing be complete. Okay, that is what I'm trying to do. Okay, that is it. Then the third one is the antacids. Okay, the antacid. Okay, those antacid neutralizes the acid. Okay, I'm saying Anuraj is saying it neutralizes the acid. Yeah, antacid helps to neutralize the acid in the stomach. Okay, that is what we get. That is why mostly if you check the antacid, like the Gestid, the Gaviscon, the Jawacil, all those ones are brown name. Yeah, if you check them, you will see that they will say it's good for heartburn, indigestion, and also they will tell you gas, constipation. Okay, to help to neutralize the acid. You know, when it has to do with ulcer, the symptoms of ulcer is bloating. Your tummy could be big and you'll be seeing so much gas in your stomach. Okay, so you need to take the antacids to neutralize the gas. Because if you finish blocking all the holes with the proton pump inhibitors and you have not taken the antacids to neutralize the stomach, your stomach will still be as bloated and it will still be having that gas, making you to be polluting up and down. You understand? Bringing out gas from your anus up and down. So what you need to do is take the antacid. So okay, so as I've told you before, combination of two antibiotics, then you need your what, proton pump inhibitors and their antacid. Okay, so you're going to be taking this therapy for at least 2 weeks. 2 weeks. After 2 weeks of taking this therapy, then follow the instructions that I told you not to do if you have ulcer. I bet you 1 year, 2 years, 3 years, 4 years you will not know what is ulcer. You will just tell, I have ulcer before, but I don't have it again. I'm telling you. Have you ever when somebody say, I'm a living witness? Have you heard that? Okay. I'm a living witness. Okay. So when you just follow this path, you will know that ulcer will be far from you. And if you don't treat ulcer right, like if you don't treat ulcer right, there's complication. What we call complications of ulcer, what ulcer will do to you if you don't treat it rightly. Okay, so don't take ulcer as simple as you think. It's not as simple as you think. It has to do with your stomach. It can cause stomach cancer. It has to do with your stomach. Okay, it can cause internal bleeding that will land you up in the hospital for brain surgery or even death. Okay, it causes death too, so please don't play with your stomach ulcer. It's simple. It's simple. If you want to take acidic food, eat first. Okay, if you want to drink alcohol, take moderate, not excess. Okay, smoking, you can go away. If you're the type that you're a chronic smoker, then you can just do it bit by bit. Okay, it's not hard. Pain relief, there are good ones for you. Just open your mouth, tell the pharmacy, I have ulcer. Fine, we'll give you better ones. So what's the big deal? Must you go and do self-medication always? Self-medication is the problem, number one problem that is bringing this pain relief, this NSAID or use of NSAID. You go do self-medication. Only you want to put ibuprofen, only you want to put diclofenac, only you want to put peroxicam for one pain. Abba, kilo day. That was how the girl there was a girl that landed herself in my pharmacy because only she took ibuprofen, Felvin For what? Because she have menstrual cramp. Menstrual cramp, you are going to mix drugs by yourself. And she landed up, well, what will I do? Treat her and take my money now, because you are talking, they are not hearing. So treat her and take your money. So that was it. That is as bad as it is. Please, please, please stop self-medication. Let's don't be doing that. Okay, that is it. Then I've told you the drugs, the symptoms. I know you people that have ulcer already know what they feel if they're having ulcer. All those back pain, waist pains, gas in the stomach. You know, this epigastric pain, the pain at this your chest place. That you say my chest is burning me this downside. You know, if I want to put my palm, you say ouch. All those pains, everything. So that is to show that you have ulcer. So I already know. So I've told you the complications. Please don't keep your ulcer. Okay, and there are surgical this thing. Also, you can do natural ways like aloe vera. Aloe vera too is very good. It's a natural therapy. Aloe vera drink is a natural therapy for this thing. It's helping wound healing. It's good in wound healing. Okay, then you can also try honey with a glass of water. Honey tea is very good, and turmeric too is very good. Honey, turmeric. Okay, those are natural way that I put that. Honey, turmeric is very good. It's very, very good for stomach ulcer. So please to avoid internal bleeding and open sores and even sometimes cancer or some kind of serious complications. Please try to treat your ulcer. Treat your ulcer and follow the steps that I've just mentioned. If I forget any step, put it in the comment section. I think Anuraj has gone. Anuraj, are you still there? Are you still there? Anuraj, the mighty one, are you still there? City Rama, thank you all for joining my live. Oh, my second day live, people join. Oh, thank you. This is my second time of coming live on YouTube and people joined. And it wasn't that bad though. Yeah, I wasn't scared of the camera. We are doing it well. Well. So please, people should come for more. Okay, next time we'll be talking. I know what is raining in the country now. Infections here and there. Okay, it's gonna be more educative, sweet. Imagine me bringing out a suppository. Okay, yeah, a lot of persons have been asking this question under that my video that where I talk about how to use their best job for candidate. They're asking how suppository is, how it is. I will bring and insert something and I will show you how to use suppository. Okay, I'll write that down so that I won't forget. Yeah, in my next video I'm going to teach people how to use suppositories. Okay, so that you will use it first. Thank you everybody for joining my life. It's used a lot of time. Please don't forget to like, subscribe, and put your comment down. Please follow me for more. I am happy and I know you are happy also. Okay, thank you. Any mistake I make, I beg. It's my first time of coming live on. It's my first time of coming like this, so please bear with me. I love the network today. I love everything, so I'll be using this please very much. Yeah, thank you for those that say I look like a doll, and thank you for those that I'm looking beautiful. See you next time. Bye.